My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, welcome back to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to be joined by CEO and founder of Vitable Health, Joseph Kitonga. Joseph, welcome to the podcast.
Thanks for having me.
Absolutely. So, Joe, really excited to have you on the podcast. Joe was at Penn State University before leaving to pursue the prestigious Thiel Fellowship to build Vitable Health. For those who may not know, Vitable is building a new health plan that works for everyone, starting with primary and urgent care coverage. Also is a Y Combinator backed startup from the summer of 2020. Joseph previously was a co-founder at Golan, building an Ethereum blockchain wallet, and was accepted into the MIT Sandbox program. Prior to that, he built a social event platform called What's Poppin', and Joseph also interned at Microsoft and did project software at IBM. Welcome, and we're excited to talk about your company and your career.
Thanks for having me. I've been a huge fan of the conversations and awesome guests that you've had. So it's a real pleasure and privilege.
Yeah, absolutely. We're excited to have you on, Joe. So what inspired you to build a company within healthcare?
So my family and I immigrated from Kenya to the US when I was 13, and I had the privilege of a lifetime just watching my parents chase the American dream. And they were initially caregivers when they came over, and they started a small business, hiring other caregivers to take care of seniors in their homes. And they're fortunate to sort of build it to a meaningful business over the last decade and a half, where they have about 200 caregivers that work with them. But part of what inspired Vitable was that those caregivers made too much to qualify for Medicaid, too little to afford the Cadillac health plan. So the majority of them were uninsured, stuck overutilizing the emergency room, where upwards of 70% of ER visits are unnecessary, costing an average of $1,300 per visit, which is just a lot of money for anyone. But it's especially taxing for the everyday worker. And this isn't a story like what I just shared about the ER visits. Every digital health company or healthcare company typically shares a version of that. But for the part of what was quite striking to me was that for my parents' employees in particular, most Americans don't have $400 saved up for a medical emergency. That's doubly true for the everyday blue-collar worker. Makes upward mobility more difficult, but more importantly, at least to me, it also, generally that lack of access generally also leads to worse health outcomes. And I learned of this stat right before I started Vitable that in Philadelphia and most major U.S. cities, two zip codes just a few miles apart, the average life expectancy difference could vary upwards of 20 years.
That's crazy.
It's not rocket science why that's the case. There's a few variables that contribute to it, but the one that I felt most compelled to focus the rest of my career solving for was that there's just a lack of access to high quality preventative care. And this was sort of like more pronounced because when I'd go to Microsoft, I studied computer engineering at Penn State. I'd intern during my summers. I'd go to Seattle. I work at Microsoft on Xbox, and it was amazing. I love building for the sake of building, but at Microsoft, you have amazing healthcare, no copays, no deductibles, on-site clinic. It's honestly the best, at least I thought, the best healthcare experience that one could have.
Yeah.
But I'd go to help my parents at the end of the summer, and their employees couldn't afford a $50 or $100 copay. And I just felt like there was this massive disconnect between my experience at Microsoft and the everyday employees that my parents and my parents' small business, that they made too much to qualify for the government-sponsored sort of Medicaid, but they couldn't afford a good plan, and they delay getting access to preventative care, and it contribute to this disparate outcomes of life expectancy. So anyway, that was a central problem that I was looking to solve, and I was fortunate, like you mentioned, to get the Thiel Fellowship. So I dropped out my last year of school to focus on this full time. But the core thesis was that there's a lack of access to high quality preventative care, and I think care, if I could move the needle on increasing access to preventative care for the population that resembled my parents' employees, that would be a life well lived. And so, a few years in, and I feel like we're just getting started.
Great. Tell us about your experience with the Thiel Fellowship. What was that like, and how has it been helpful to you and your business?
Yeah, so for context, for those that might not be familiar, so the Thiel Fellowship basically gives 100K to 20 people, about 20 people every year. Only requirement is that you drop out for 2 years to pursue whatever thing that you're building.
And is it only people within a university, or could it be like someone, quitting their full-time job?
I think the requirement is that you have to be under 2022. Typically,
Gotcha.
for someone that's typically dropping out of school, it was started by Peter Thiel, and the core essence was just that school is not the right fit for everyone, especially people that are excited to build and innovate, and so the help was really, it felt like being given permission to build and chase like some sort of dream. But like honestly, throughout my college career, I'd taken sabbaticals like often. During the introduction, you're describing some of the, what I now call projects, but at the time I called startups that I'd focused on. They didn't go anywhere, but I just love building for the sake of building. I was going to drop out to build Vitable because I felt like it was really my life's calling, and it didn't, the outcome is not as important to me as just I love the process of building. And, with Vitable, it just so happens that as I, sort of pursue becoming a master craftsperson at building things, the impact is that we help increase access to high quality preventative care for a population that's been so underserved. And so, the Thiel Fellowship for me felt like it was, permission to do so. But my parents, my maybe immigrant parents, were not as excited about what they, thought was quite reckless behavior and leaving schools. I'd gotten a full-time scholarship to go to Penn State, and that was a big part of me going there. And so by dropping out, I now have student loans that I wouldn't have otherwise had if I just finished school and I had a full-time offer to go back to Xbox.
With no risk, there's no reward. So life is about making tough choices.
Well, I think that's generally true, but in their mind, they felt like I'd worked so hard to get to, and I've had the most privileged life. Their feeling was that they'd worked so hard to get here, and like I, had a guaranteed job at Xbox, and my friends were all buying Teslas with their just signing bonus. So the life that I would have had, it felt like I was going backwards as opposed to what then was like this like step change in my life. But I do agree. I felt like, at least to live up to my purpose and to live a life that I'd be excited about telling my grandchildren about, this just felt like soon after I dropped out, the pandemic happened and it accelerated the adoption of virtual care. But at least at the time, it did feel like my parents felt like it was a huge risk. But to me, actually, it just felt like I wasn't really taking much risk. The worst case that could happen is I go back and get my job at Microsoft, or finish school or whatever it may be. But it felt like I had to, it was more of my life's calling, and I had a bunch of reasons why that made it somewhat easier.
Great. How does Vitable care model work, and how is it different than the traditional primary care model that we see in this country?
So I think everything we've built at Vitable has been tailored to an audience. Initially, like, we focused on essential workers during the pandemic. So, senior care employees, restaurants, childcare workers that had to go out and work to keep our communities running during the pandemic. The essence of what makes Vitable unique is this direct primary care plan that we've built. And you could think of this as what, like Jeff Bezos is like, what makes your beer taste better sort of idea. It's employers pay a simple membership fee to give their employees access to our network of providers that can either see them virtually with no copays, and this doesn't hit their deductibles, or if necessary, in specific markets like Pennsylvania and Philadelphia, our providers can also make in-home or workplace pop-up visits. So similar scope of care to that of a brick and mortar primary care practice, but substantially better cost structure. And, that makes it inherently more scalable. But in addition to giving employees or members access to our network of providers. We also include within the membership access to 40 plus of the most common lab tests, 1,000 plus prescriptions for free, a mental health program for free as well. For things outside that are not covered outside of our membership, we embed care navigation, a team and a platform that enables us to route them to either a first party cash pay network where we've negotiated deep discounts and they could use a debit card that we provide on our app to get access to that, or if they are insured, we can route to high value providers that are within their network. But the core essence of this direct primary care membership is that, one, reduce all barriers of getting access to care. So no copays, it doesn't hit your deductible. You just log on to the app, same day, next day visits. Include like about 70% within this just membership. Include about 70% of cover about 70% of the most commonly needed healthcare services. So high frequency, lower cost healthcare services, not the low probability but high cost events that like insurance should cover, but like more of the everyday needs that like typically insurance actually increases the barrier of getting access to, and I think like largely contributes to the disparity in outcomes. But we embed that direct primary care plan with catastrophic or major medical coverage. But majority of members come to us first whenever they have any healthcare need, and we sort of take care of them. And I think the to your question of like what makes Vitable unique, or like our view of how healthcare should work, how is that different from the prevailing sort of system? And I think the core of it is just that like we tailor our experience to the member, and it's like delightful. There are no barriers. It's not complicated. You don't have to go to download a million apps.
Yeah.
And for like at least being an outsider to healthcare, it's surprisingly like the most healthcare experiences are not actually consumer experiences, and and obviously there's like reasons why, but because I've been an outsider to healthcare, we like have built largely outside of the system, which has been to our advantage in most cases, because it's just a better, higher NPS experience for members.
Okay. And what's the biggest challenge in building a hybrid model of in-home and virtual care?
I think the biggest challenge is actually helping members initially it was helping members understand what we are. Because we started like we initially we only offered our direct primary care plan. We didn't have wraparound coverage like we now do with ICHRA and other level funded plans. It was helping members understand what is direct primary care, and the question we'd often get, where is the brick and mortar location or address that I'm going to go to? That was the biggest challenge that we had. We've been lucky that we always found provider partners that were excited about increasing access to care, and we built the entire sort of technology that they use from our EHR and other internal tools. So it was quite easy for them, and we never really struggled attracting providers to work with us. It was often just helping members understand how we were different. But we've been lucky that we had incredible employers that we partnered with that help us bridge that gap.
Any that you're able to mention that have really benefited greatly from working with you?
My mom was our first client.
Okay.
Visited all 200, they had about 200 employees. To start, visited each one of their employees in their home to understand, what problems did they have with healthcare. Steve Blank has this, statement where he'd say, get out of the building and, go talk to users. That building deep empathy for who we're building for has been just a large part of what makes Vitable unique. It's really just that I could go and talk to my parents and their employees and visit with them and understand the problems that they had with their healthcare system. But one of our earliest members actually, I was speaking with recently, and he was describing to me how Vitable was. And this sounds so simple for most people because it's not like this isn't earth shattering, but it was just he'd struggled to find a mental health provider. Mm-hmm. And he didn't realize that we'd added a mental health offering. So he went on his app, he was speaking with his primary care provider, Vitable, and they recommended that we actually considered like seeing a therapist, and he was able to book one. And he mentioned he got some prescriptions as well to help with anxiety and also covered within the membership. And he just said, I've never felt like I could be a part of a healthcare system that actually cared for me. And he got a bit tearful, but I think the like we understand what great care looks like. I had it at Microsoft. People have had it for, decades now. It's access that's the problem. And, I think going back to visiting all of my parents' employees in their homes to build empathy on like, what do they actually care about? Like, what could we do to help? The thing that's been consistent across the board is just people want to feel like you care about them. Technology is an enabler, but it's really how do we just increase access to care and like have a team that is on their side and that they feel that they could turn to in the moments of pain and need.
Yeah, something I love about you is just you're extremely humble and you don't broadcast your success. I would guess that considering, Peter Thiel Foundation, Y Combinator, in 2024, you raised 16 million on a Series A from Cherry Rock and First Round Capital, Tier 1 VCs, in a very hard market to raise. So I assume you have other customers outside of your parents' company. Can you kind of walk through like some of the scale? Because I don't want people to get the wrong impression that this is like some small company where you have one customer.
I see. That's fair. So I think we have about 100,000 members that we cover. We started in Pennsylvania, and we've largely stayed in Pennsylvania until last year. That was intentional. We have about 100,000 members. We've raised 25 million to date. We're growing extremely quickly. And like members use and love it a lot. So our annual clinical utilization is about 5 times higher than most of the leading virtual care companies. When members use it, they love it. We have an average of 92 plus NPS any given month or week. And that's enabled us to actually lower the total cost of care for any plan that embeds our direct primary care plan as a front door, an average savings of about 12%. So like what we're building is effective. People use it a lot. They love it. And like we actually reduce the total cost of care, not by decreasing access, but just by being effective and people wanting to use it as opposed to other care options. I think the more important thing that I think is, at least the thing that I'm most proud of, is that we've been able to, because we built the entire like technology stack that we own, from the member app, the company client dashboard, to the electronic medical record system and other internal toolings, we actually enable providers to spend more time with the patient. So our average visits are like much longer, 3 times longer than the average primary care visit. Like you go on our app and you could schedule a visit today, and it's like a true relationship that the members have. I think part of what enables us to now work with over 500 employers, and it's not the very smallest employer. Like our typical client has about 500 or 200 employees, like my parents. But we're so early in our journey, and maybe this is part of why we've been generally just focused on delighting members, because still today 70% of our members are in Pennsylvania, and it wasn't until last year that we are now available in all 50 states, and we went from 80% of our new lives coming from Pennsylvania last year to now 80% of lives coming from outside of Pennsylvania.
Can you serve any employer in the country, or is there specific types of employers that are best suited to be Vitable customers?
We have school districts as customers, like restaurants, school, daycares, senior care agencies, and as well as startups. But I think our focus and my passion is that I want to increase access to care for the people that don't have access. Like our offering is just great. Like anyone would find value using it. And we have clients across the variety, the spectrum, but where I find like most fulfillment, and where hopefully like in, 50 years when looking back on this experience, it'll be because we helped increase access to blue collar employers that don't have many options. That's really who our mission is tied to. But our offering is just great. Any employer really that's looking to lower costs will find value. But more recently, I think part of what we're most excited about is pairing our direct primary care plan with ICHRA administration. And especially, again, for employers that are looking to lower the continued increase in costs. I think health insurance costs have increased 52% over the last decade, and income and also revenue growth for most businesses is not kept up. ICHRA is an amazing option for those employers. And like we saw huge adoption just going into Q4 of last year. like it felt like this inflection point that I'd never seen anything like it before. And part of what we're betting on is that, so we acquired this company called LifeRaft, who'd been our partner before, to launch our integrated ICHRA Plus direct primary care offering. I think every employer, regardless of sort of segment, is dealing with the increase in healthcare costs.
Yeah, sounds fantastic. Y Combinator is not an easy program to get into. How, was that experience for you and your team? And, how did it help shape the trajectory of the company?
Was a dream of mine for a really long time.
We've
I'd
had some
applied.
YC companies on the podcast. So,
Yeah, yeah.
Pelago, formerly known as Quit Genius, Meru, another one. I'm sure there's others that I missed, but, we have a bunch of YC alumni who have been on the podcast before. So we're excited to have another.
No, I mean, YC is like it was a dream of mine for a really long time, and the companies that you mentioned, I really respect and admire. And I tried to apply. I'd applied for YC and gotten an interview where they fly you. And for 3 years, I got in the last year, but I was rejected 2 times before, and it was always on my birthday. So I'd fly into San Francisco from Philly. It's a 10-minute long interview. I'd go in for the 10-minute long interview, and I'd get the email and go back home. Fly back home on my birthday, quite sad.
Damn,
but the third time is a charm, and they let me in. I think part of why YC was so impactful and such a step change in my trajectory and in the business and Vitable's trajectory is that, like there's incredible companies that have gone through YC, Stripe, Airbnb, Instacart, and others. Honestly, without YC, Vitable might not exist in the way that it exists today.
Mm-hmm.
It gave me an opportunity and a network that I never had before, and opened up, opportunity both for recruiting early team members and just enabling us to hit our stride. But part of and I always joke that every investor that's ever given us money is needed to see me 3 times before they get to conviction.
Mm-hmm.
And it's not that whatever it may be, they don't meet me the first time and they say this guy's a killer. And I often have to come back and show like momentum from the last time they met
Mm-hmm.
me. But that's been like a big part of my advantage. And one of my professors and earliest investors that's been quite impactful for me often describes it as my superpower is being scrappy and a cockroach. And YC was one example. Same thing with first round capital.
Our friend over at Hinge Health, Dan Perez, they if they had a mascot and it was an animal, they consider themselves like, hey, we're the cockroaches. Like, we'll be around far after anyone else is, because we have the right focus and mission.
I love that. And Dan is like just one of the kindest, like most formidable builders, not just in digital health, in any company really, and like huge outcome.
I would agree.
And I sent out many cold emails early on, and like very few people respond naturally, but Dan was just so gracious with his time, and he's a voracious reader. And
so did you get the cockroach analogy from him, or did you come up with that one on your own?
I actually heard about the cockroach analogy when I watched one of your episodes recently. Nice. But the cockroach it was actually while I was still at school, and I'd keep getting rejected from YC, and they said, well, the thing that there's generally 2 types of people. Maybe there's the people that people just see and like say, this guy is an absolute, or this guy is extremely formidable. They just like doors are open because of who they are. I'm more of the other type of builder where my advantage is that I just don't quit. And being an outsider both to healthcare and to startups with no network, the superpower has just been, you don't need to believe in what we're doing or in me now, but I'll be back next year. And usually people are very kind and eager to help people that just show that they're moving quickly and able to get progress.
Hypothesis on why 99% of founders go into a YC or a Thiel Fellowship or a fundraise, and they oversell what they have. The product's better than it actually is. The traction is bigger than it actually is. Their customer list is bigger than it actually is. Like, they tend to give a very rose-colored glasses picture of what the business is. I think you probably do the opposite. You undersell all those things. So initially, they don't know what to do with you because they're like, this is so different than anything else. Like, why would he come in here and not share all the progress and all the success, and almost your just great ability to be very modest, like actually hurts you in that sense. So I would say like that could be a small part of the reason also, is
I
most
think it
people
absolutely is.
are full of crap. Let's just say you almost undersell and underemphasize the success and the traction and what your future company could look like or could be. So just another thing that I think factors
I
into
think
it.
that's like I think that's absolutely spot on. And I've been fortunate to get a lot of like amazing feedback that's helped me grow. And I think I've gotten better at this over time. If I love simplifying things into two archetypes. So if there are two archetypes of founder, I think or if there's a spectrum of like overly salesy, and not actually telling the story in a compelling way. In my journey, I was more on that end, and I think it's unlikely that I'll ever be on the other end of the spectrum. But I think even Vitable as a culture is one that is, we over-index on delivering, not shouting about all the great things that we're doing. And there's for sure like trade-offs to that. But I think one of the companies that inspires me most is sort of Walmart and their journey, starting by serving small towns that the largest retailers wouldn't go into in a way that most people wouldn't understand. And it wasn't until they were quite large that people started to come around to there's something special here. And there's something that I find quite inspiring about that journey, and also just who they served. It wasn't going after the flashiest of folks. It was serving sort of like Main Street, a small town America that is quite inspiring, and we hope at least available to emulate.
I like it. What advice would you give a founder that's going through YC or considering applying to YC?
I think ultimately you have to build a good business. Every investor, YC included, invests in X number of companies, and most fail. And I think if you have the opportunity to take YC to go through YC, I'd absolutely recommend it. But it doesn't make your business. There's tons of people that get into YC. The first thing they work on doesn't work, or the next thing doesn't work. And ultimately, you still have to build a good business and build something that people want. And I think there's no shortcut to you have to do that regardless of when. It's the rite of passage for, I think, any great business. And the advice that I received early on was just the only thing that matters is truly talking to users and building something that they solving a problem for them that they want. And I wish it was my advice. It's really the advice that YC gives. Talk to users, build something people want, and sort of don't play startup or do things that might feel good, like you're building a business, but really ultimately are just you focusing on everything else that maybe doesn't matter.
Okay. How does your company provide free prescriptions? That one kind of shocked me.
So we work with a PBM where we just create a formulary and like cover the cost of those most commonly needed prescriptions. But it developed from, again, going back to talking to users. When I visited my parents and their employees and spoken to all 200 of them in their homes, some of the things that I'd ask, what do you use? What do you go to a doctor for? And like, what are the problems that you have? And oftentimes it was just, it's so painful to get this prescription that I need every month or every 3 months. I wish it was easy. And I'd ask, how much are you paying? The prices were quite absurd. And we found a way to work with a PBM where we negotiated like really favorable rates, and we just basically offer it for free to our members and make it really simple for them to get them. Because if you're one interaction every month with the healthcare system contains so much friction, you're unlikely to get help when you do have a need. So it came from talking to users then, and over time we've continued to add on, and more recently added GLP-1 program as well. But every instance we get where we can negotiate and share those cost savings with our members, we take it, because it's no secret that prescription prices have continued to go up and are a huge driver of the increase in healthcare costs in the U.S.
Yep. We talk about that subject a lot on this podcast. What are you most excited about for the next 5 years at Vitable? What do we have to look forward to?
I think our core thesis has been more of the healthcare dollar should go to fund care, not administration. And by vertically integrating, we can actually cut out the administration costs and margin and share those cost savings with our members. It's been defined as this movement from defined, contribution to defined benefit rather to defined contribution, similar to the shift from pension funds to 401ks. And the earliest iteration of this is driven by admin only vendors, and some of them, not all, some of them are pricing at close to $100 ppm for admin, which is just extractive to the system, and it's focused again on like the employers that have this need, and the earliest adopters have been blue collar employers with everyday workers. And our approach is just get primary care. Our direct primary care plan will integrate the admin and build technology to lower the cost of doing so. So in essence, we're giving it away at free or cost. And so for less than you'd be paying for admin only, you're getting our direct primary care plan. And that's been, we're winning 100% of deals, at least so far, against admin only vendors. And so our focus the next 5 years is doing what we did in Pennsylvania and replicating it across the rest of the country, like layering in care and admin in a way that like reduces all of the administrative costs and ensures that every dollar that employers and employees are spending in their care, as much of it goes to care as possible. Because, I think with AI especially, it's possible now for administrative costs to get close to $0. And I think that's like good for the system and it's good for members. And I think it will have impact on increasing health outcomes and bridging that life expectancy gap that's in most major cities.
Okay. Love it. We ask everyone who comes on the podcast, how do you practice what you preach? You live, breathe, sleep healthcare. Being CEO of a growth stage company is a very stressful job. How do you, find ways to reduce stress and exercise in a job that you say, hey, I don't give up, I outwork my competition? That's one of your secret traits of success.
I think life's a marathon, and like building a company is a marathon. Part of what I love about Sam Walton's story, my favorite book actually, Made in America. Part of what I admire and inspires me most about Sam Walton's story is that part of the journey is just he outlasted all of the big name companies that competed with Walmart. And so anyway, life is a marathon, company building is a marathon. And as long as we continue focusing on like building for and solving a real problem for our members and doing things that are, not necessarily contrarian, but like when others are zagging or if the prevailing wisdom is X, I think our advantage is just like continuing to do what we know is true for members. And so how that actually translates to actions, I think I read a lot. I try to read one book a week. I meditate a lot, I try to meditate every day. And I try to spend as much time speaking with members and clients to remind me of like the why I started Vitable. The outcome will take care of itself, but I think the thing that will kill Vitable or like kill most companies is really the team giving up. And I think like a big driver of that is as like cliche as it sounds today, and like this might sound soft, but I think it's true. Like just the mental health and how excited I am about what we're doing. I'm Kenyan, so like
totally help avoid burnout. Like that is probably scientifically proven.
Yeah, I think so. I think like the secret to like finishing a marathon is just just like not giving up and just continuing and taking one more step. And I think to do that is just like a lot of ensuring that you're at your best mentally and physically. So I do actually run a lot.
Cool. I like it. I think, no surprise here, a huge determining factor of your health is what you're putting into your body. Any healthy recipes that you make that help you, perform at optimal levels, maybe even recipe from your, native Kenya?
I don't cook that often.
Does your family cook, or you have like a family recipe that like when you want to eat healthy and you want to feel good, you tend to ask for it to be made.
I'll embarrass myself a bit, but I'm on the camp of, eating for sustenance, not for enjoyment. So I tend to, eat like I'd be happy drinking Soylent maybe. I think that's out of fashion today, but I try to eat mostly a, vegetarian-esque diet
I
with,
eat almost entirely plant-based, so you're preaching to the choir, man.
that's amazing. I've seen your episodes where
All
you
right,
cook.
so let's
That's,
talk. What do you got?
yeah.
What can you suggest that we can make and say, hey, Joe at Vitable told us to make it and we're enjoying it?
I unfortunately don't have any suggestions. What would you suggest? What's your most recent favorite meal
So
to
many
cook?
good ones. I think that muhadara I made the other week with the rice and the lentils and a little bit of vermicelli, noodles, good olive oil, so there's some healthy fats there. We got protein, we got carbohydrates. It was really, really tasty and makes it really easy to eat healthy. So I vote muhadara, but there's so many good ones.
Have you always had a passion for plant-based meals?
Interestingly, no. I started to have gastrointestinal issues in like my mid to early 20s. And it started to be, such a hindrance and like really hold me back and just didn't feel that great. So I went to a gastroenterologist and like he recommended doing that. And I felt a lot better. I'm totally a huge believer in putting really good, high quality, whole food, plant-based food into your body. Allows your, body to run optimally, recover quicker, reduce inflammation, reduce brain fog. It's like totally changed my ability to, focus and, live a very, very energetic life. So I'm a big proponent of it. And if you have any recommendations that you think of after, just email us and we'd love to give you the credit for recommending a recipe that we end up making on the video series. But, either way, really appreciate you joining us on the Digital Health Heavyweights podcast. Joe, thank you so much. Excited to see what you and Vitable accomplish over the coming, months and years. And maybe we'll have you back as you guys continue to scale.
Thank you.
Thank you. All right, take care. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.